We have recently wrapped up our unit on the digestive system, and we're starting on the next system, which in this case will be the circulatory system. We're going to start with the main organ of the circulatory system, which is, of course, the heart. Now, your heart is about the size of your fist. So if you want to get an idea of what that would feel like, put your right hand on your chest, like you're about to say the pledge to the flag, and then without moving the hand, make a fist that would be about the size and placement of your heart. In fact, your right lung has 3 lobes, while your left only has 2, because your heart takes up the space where the 3rd lobe would be. We see we have the superior lobes on both sides and the inferior lobes on both sides, but the right side has a middle, while the left side does not. And so that cardiac notch is where the heart fits in. So it's a little bit to the left of center. Looking at the anatomy of the heart, we are mammals, and birds and mammals have 4-chambered hearts. And 2 chambers receive blood. Those are called atria. We have a right atrium and a left atrium. And these have very thin walls. And if you ever see an actual heart, you might not even recognize the atria. They're pretty well deflated and not a whole lot of substance there. The atria on the upper portion of the heart, which means that they are superior or above the other 2 chambers. And those other 2 chambers are called ventricles. And we have a right ventricle and a left ventricle. And notice that the ventricles are roughly V-shaped. And you get the overall shape. The Valentine heart that you're familiar with has kind of that roundish top and the pointed bottom. That's basically where that comes from. The heart is probably actually tilted a little bit more like that. But for our sake, I'll just make it kind of straight up and down. Let's see. The ventricles themselves have very thick muscular walls, and they hold their shape pretty well. And those are the chambers that do the pumping of the blood. And you might notice that there are valves here between the atria and the ventricle on both sides. Those hanging down flaps are valves. And those prevent blood from flowing backwards in the heart. All right. Let's see. The blood vessels that carry blood toward the heart are called veins, and those that carry blood away from the heart are called arteries. Some veins and arteries around the heart have special names. Veins entering the right atria are called vena cava, which is the plural form. There is a superior vena cava and an inferior vena cava. Of course, superior is above and inferior is below. The veins entering the left atrium are called pulmonary veins, and there are 4 of those. Two on the left side of the heart, and over here are the 2 on the right side, and they will enter the atrium right there from the right side. The main artery leaving the right ventricle is called the pulmonary artery, which is this right here. And again, there's a left and a right pulmonary artery. And the main artery leaving the left ventricle is called the aorta. and it curves over the top of the heart and then even goes down below to the rest of the lower body. Okay, that about covers the anatomy. Again, we've got the valves here between. There's a valve here, one coming between the right atrium ventricle, one between the right ventricle and the pulmonary artery, one between the left atrium and left ventricle, one between the left ventricle and the aorta. So that should take care of our heart anatomy.